Hi, my name is Naomi. I am the physio manager here at Practice Plus Group Plymouth, and I'm here to tell you a little bit about our joint school. So when you get the date for your surgery, you're going to be invited to come and participate in our joint school. We run this every Monday, and it's an hour-long session where we tell you everything you can do and what to expect in preparation for your surgery. So we cover everything from exercises that you'll be doing to prepare, any nutritional things you need to keep in mind to prepare, how to look after your skin best. We then cover what you'll be expected to do in hospital and how we can support you using equipment and exercises. And then we also cover what to expect once you get home after you've been discharged from surgery. When you come in for joint school, we do encourage you to bring somebody to come with you. So think of them as like a care or recovery buddy or somebody who'll be nearby to you when you're recovering. 2 pairs of ears is always better than one, and it's quite nice to have somebody there listening in on some of that information. They may ask a question that you've not thought of, but may be actually very, very relevant to your recovery. We've got a really warm, friendly team. We look forward to seeing you. We've often got one of our nurses there as well that can talk to you about any medications that you're going to need when you get home and how to manage pain and swelling after you've had your surgery. We want to make sure you get the absolute best result following your surgery, so we really look forward to seeing you.
Hi, my name's Ros. I work in the outpatients department here in Practice Plus Group. Now that you've had your initial consultation with the surgeon, where you've been consented to have your surgery, you're now going to come in to see me, and we're going to do some pre-op assessment tests. So I'm going to just do your OBS, like height, weight, blood pressure, routine bloods that we do for every patient coming in to have their surgery here, swabs, etc. After you've seen me, you'll then see one of my colleagues, just to make sure that you're fit to have your surgery here. So it'll just get some background history on you, which will be asking you questions like any medications that you're on, any allergies that you might have, previous surgeries, that sort of thing. We also have to make sure that we run through a list of do's and don'ts before you come in. So ideally, we would be giving you hints on things that you need to stop, which would be any herbal medications, blood thinners, etc. We'll go through all that with you at your consultation. You'll be given the opportunity to ask as many questions as you like. Hopefully we can answer all your questions for you. One of the things that they are particularly hot on here is to make sure that your skin is intact. You have no open wounds, because you'd be at such a high risk of infection. So we do stress the fact that please don't be going out and doing any gardening, getting any new puppies or anything like that. It's going to cause any scratches, cuts or anything like that because of the risk of infection. We'll be giving you some Hibby scrub, which you need to use 5 days before you have your surgery, and all the instructions, you'll get a little goodie bag to take away with you. In that goodie bag will be some leaflets about the physio, the aftercare, and again with all the body scrub, body wash that you need to use, and a list of medications that you need to stop. We look forward to seeing you and having part of your journey here with us at Practice Plus Group.
Hi, I'm Mrs. Lorraine Ham. I'm 62 years old and I've had both my knees done at Practice Plus Group. I was mainly housebound. I didn't drive for 3 years and I was struggling with the stairs. I was struggling to get out of chairs, just couldn't go out. It was too painful to walk. And then I asked to come here, and I'm really glad I did, because from the time of the X-ray and MRI, the pre-op and the operation was all within 3 months. They prepare you for the physio, and they also explain, you know, what's going to happen with the operation. They talk you through it, you know, you can ask anything you want, but everything was explained how I wanted it anyway. I didn't have to ask very many questions because they just explained it so easy and comfortably for me, and I couldn't thank this place enough. You know, without the operations, I wouldn't be outside the door. I am so glad that I had it done. So now, I'm like, I might be 62, but I'm feeling like 32.
My name is Victoria French, and I'm here next week to have my left knee replaced. I was offered to come to a joint clinic So when I got this invitation, I couldn't book it quick enough. We went through just about everything from pre-operative exercises that you should be doing to help yourself beforehand. So I've been doing exercises with this leg. I can build the strength up in this leg before the operation. We then went through the technical side of things and what goes on inside, the anaesthetic, the injections you have. I really do feel much more confident coming in, knowing that maybe in 6 weeks' time, I'll know why my leg is still very stiff and not to worry about it. And what would I expect to be in 3 months or 6 months ahead? And I didn't have a clue until really today.